If you've ever walked out of a doctor's appointment where you go to talk about hormone replacement therapy and you end up feeling confused, dismissed, or like you didn't even get your questions answered, you're not crazy. And you're definitely not alone. I have women who message me all the time. So one woman told me, my doctor said, absolutely no. Another doctor said, it's completely safe. And another woman who went in said, he barely wanted to talk about it. And you're sitting there thinking, wait, aren't all these doctors reading the same research? So let's talk about it, woman to woman. And before I do, I want to make sure that you know I've made something for you. It's called the Smart Woman's Guide to Discussing Hormone Replacement Therapy. It's free. It's a checklist. You can literally print it off, bring it to your doctor's office so you feel confident, prepared, and not steamrolled in the conversation. The link is below. Download it now so that you have it ready. And if you appreciate balanced, evidence-informed conversations about women's health, please subscribe because we're going to be having a lot of them around here. So now let's get into it. So here's the pain point that no one says out loud. You're in the middle of hot flashes, you have brain fog, sleep disruption, mood swings, maybe some anxiety that you've never had before, and you finally work up the courage to bring up hormone replacement therapy to your doctor, and you get, we don't really recommend that, or it could increase your cancer risk. You'll be fine. You don't need HRT. Or worse, a 2-minute brush off, how it's just part of getting older. And you leave feeling smaller than when you walked in. And the frustration is real. It's not because you're difficult, it's because the topic is genuinely divided in the medical realm. So let me be clear, this is not doctor bashing. I have many friends in the medical field. I respect physicians deeply. They work really hard, but let's be realistic. Doctors are only human. Not all doctors are equally educated on hormone replacement therapy. So some were trained during the era when there was a lot of fear around HRT, hormone replacement therapy, because of a huge study. Some simply hadn't had time to dig into the newer data that we now have. And some just like to prescribe things by habit and they're not comfortable. And so for being honest, they just don't want to manage it because it requires nuance, follow-up, and individualized dosing. And that doesn't make them bad doctors. It just means HRT is not their thing, and that's okay. But it matters to you. You want somebody who does specialize in this. So here's the real question. If the disagreement isn't just random, if it's about training area, research interpretation, time constraints, comfort level, then the issue isn't, is HRT, hormone replacement therapy, good or bad? The issue is this doctor equipped to guide me through this decision making? And that's a completely different question. And that shift alone can change everything. So when doctors discuss HRT or hormone replacement therapy thoughtfully, here's what they're weighing in. Benefits could include relief from hot flashes and night sweats, better sleep, improved mood stability, vaginal and urinary tissue support, bone protection, and possibly cardiovascular support when started at the right time. But they're also considering personal family history, blood clot risk, breast cancer discussions, stroke risk in certain populations, delivery method, patch versus pill, dosing, timing window, all these considerations. So the key word is individualized. There's no universal answer. So a quick pause. This video is educational only. It is not your personal medical advice. You always need to discuss your specific history and risks with a qualified healthcare professional. Okay, back to the real talk. As a nurse, my role is not to tell you what decision to make. My role is to help you feel informed, empowered, and supported. Whether you choose hormone replacement therapy with open arms and embrace it, whether you decide it's not right for you because of your concerns with your health history and you just can't take it, or whether you prefer to embrace a totally natural approach. There are many lifestyle tools, there are many non-hormonal options that we can use, and there are many supportive strategies that I employ with my clients. You do have choices, and you deserve a provider who respects those choices. So if your doctor dismisses your concerns, if they're refusing to even have the conversation, if they won't discuss updated data research, you're allowed to find somebody who will. And this isn't considered doctor shopping. You're advocating for your health, so don't be afraid to stand up and say that you want a second opinion. There's a difference between doctor shopping and getting a second opinion. And that's exactly why I created the guide to discussing HRT. It helps walk you through some of those things that you'd be bringing up in conversation, how you can think and prepare beforehand to discuss your concerns, your goals with the therapy, so that you can walk in confident and not intimidated. And you can take it to your next appointment and use it. And if this conversation resonated with you, please subscribe, because we're going to keep breaking down women's health topics in a way that feels balanced and empowering. The stage of life isn't about surviving, it's about navigating wisely, whether you choose hormone replacement therapy, natural support, or something in between. The goal is helping you to find clarity, helping you to find confidence and support, because you deserve all three. In the next video, we're going to go a little bit deeper about who should not be taking hormone replacement therapy based on the research. But as always, it's between you and your doctor to decide. Thanks.